Alright, let's see how this works. Today is Tuesday. It's exactly 2 months post-op. And I'm driving into work this morning. I've been back to work for 2 weeks now. The 6-week appointment went just fine. It was interesting. I thought that the x-ray was supposedly going to show whether the fusion was actually taking or forming or whatever you want to call it, but my surgeon said no, actually it wouldn't. There's other subtleties in terms of other small things that he might see or not see depending on whether the fusion was taking, but he could tell, he said, just by looking at me and the way I was moving around in the examining room that I was doing just fine, and the appointment was pretty uneventful. So he said, absolutely go right back to work. Still no bending, lifting, or twisting. He wanted me to wear the brace for another couple of weeks, which I did. I've stopped now altogether. The brace actually got to the point where it was kind of hurting. It was just digging into, just annoying stuff. So I've stopped wearing that, and I still no bending or twisting and lifting, constrained to 10 pounds. But basically, for 90% of every day, I don't even know that I had surgery, except for the fact that I'm completely out of the original pain that I went in for. So, at this point, it looks like it's been 100% success, and it's just been great. I have, as I've read everywhere, that everybody who has this done has a little bit of modest amount of aching sensation in their low back, obviously because of all the bone disruption between the screws and cutting off the facet joints and everything else that's done. And I have that, and it's tolerable. It's just a little bit annoying, but it's a healing process, so you don't really worry about it. I take Tylenol once in a while if I get just sick and tired of just a little bit of an ache, and I even take just one Tylenol and it's gone. It just disappears. So it's just it hasn't gotten any better or any worse, I would say, for the last 3 weeks. So it's really nothing. It's just part of the healing process. And I got a little bit of cramping once in a while down one of the other legs, but this is not even worth talking about it also. It's not, like I say, if I just get sick of feeling it, I take some Tylenol and it goes away. So I'm not going to do any more videos for the immediate future, because I start some kind of physical therapy now in 2 weeks, which I think is just going to be very mild. I know it's going to be, just some stretching things, which I think I'm already doing. I'm walking at least a half an hour on a treadmill every day at 3 or 3.5 miles an hour, fairly fast. But that's just for the sake of getting some exercise. And it's too hot here in Florida to go outside. The mosquitoes are brutal. So again, doing fantastic, and this has been as easy as I could have imagined, even though I had no frame of reference. So if anybody has any questions, feel free. Numerous people have sent me emails and things asking little questions here and there. Feel free to do that. And nothing but good news on this end. So maybe I'll do another video in, who knows, probably at the 6-month point, I guess, when I can go back to riding a bicycle and swinging a golf club kind of thing. So it's 2 months now. Today is exactly 2 months post-op. Doing fantastic. Take care.